Hey there, it's Chris again. I've got a very special guest and friend with me today. His name is Dr. Darren Goring, and he is a prosthodontist. And I practiced saying that like 10 times.
Yeah, yeah. So I'm pretty
But
sure most people have no idea what a prosthodontist is, but a
yeah,
glorified dentist.
yeah, I know it takes more schooling to get to be that specialist. I don't know, is it 4 more years? How many more years does it take?
Three more years after dental school.
I see. So you really enjoy school.
I know. I tell you, it was actually a really strange feeling the day that I finished up my residency and realized that I'm done. You know, if you think about it from what kindergarten until that time frame, I'd been in school from 5 years old till I was, man, how old was I? Old. Um, let's see, I've been out here now 7 years, so 31. I mean, a 2 year hiatus for a church mission, but yeah,
Right, right.
a lot of
Well,
school.
maybe, yeah, a lot of schooling, but it has its rewards. But
Yes,
yeah,
it
I'd love
does.
maybe if you could explain the difference between a general dentist and a prosthodontist. That I think that would be a good
Yeah,
start.
sure. I mean, in general, there's quite a bit of overlap of what general dentistry and prosthodontists will do. But so prosthodontists, I did 3 additional years of training after dental school, focusing on like kind of what it says, like prosthetics of the mouth. And so when you think about dentistry, you think prosthetics of the mouth are things like there's fixed prosthetics, removable prosthetics. So fixed prosthetics would be crowns, bridges, implants that are you're using to put a crown on or something like that. And then removable prosthetics, things like dentures, partial dentures, and implant kind of snap-on dentures and things like that. So it's 3 additional years of training on the more complex restorative cases of dentistry. Um, Kind of getting as close to engineering and dentistry as you can kind of get.
Wow. So you're engineering a new mouth.
Pretty much, yeah. There's a lot of biomechanics and material science that actually goes into it.
Huh. Well, the question I had, you said the attorney, the implant failed or didn't work. What does that mean? I said,
So when a lot of people when they hear implants, they kind of automatically think of like a tooth with like the implant. So
mhm.
the implant itself is actually just the titanium screw that goes into the jawbone. Um, Now, success rates of these are usually about 98% success of these implants taking, but she had 7 or 8 implants fail before even attaching a tooth to the implant. So not very common for that to happen.
Wow. So, like, yeah, I guess with an implant, you're drilling a post into the jawbone, and you're saying that the bone didn't heal around the post.
Right. The bone did not attach to that implant.
So you go to screw the tooth on, and it just like spins. It doesn't.
That's a
Oh,
bad day, yes.
yeah. So you couldn't put a little cement down in there.
Not quite, not quite.
Oh, well, it's interesting. I know that you helped my father-in-law as he got older, and I think he had to have dentures, and I mean that's got to be a tough day for the patient to have all their teeth removed.
It is. I've helped a lot of patients through that process, and it's a challenging process to go through. So it takes a lot of helping a lot of patients to work with the patient and help them through that difficult process because it's your chewing ability with natural teeth versus dentures is about 1/4 of your natural chewing ability.
Really?
Yeah, it's a challenge.
So your diet with dentures changes.
Yeah, pretty significantly. You're not able to eat as many of those high quality foods. Um, because if you think about it, the good, healthy foods that we eat, like nuts, the vegetables, especially like raw vegetables, fruits and things like that, they're pretty hard.
Yeah.
Uh, so,
Or I guess your blender becomes your best friend.
or your blender becomes your best friend. Yeah.
Oh, interesting. Yeah, just personally, I don't think I told you this, but just a few weeks ago, I had my wisdom teeth taken out.
Oh, you still had your wisdom teeth?
Yeah, I had all four of them at
Oh, that's harder
52.
to go through as older as opposed to when they're just forming.
You know, and that I was so wimpy. I think the dentist had to like talk me through it. It's going to be okay. And I finally came back to the fact that like, why am I being so wimpy? I mean, some old people have all of their teeth taken out.
Yeah.
So what's the big deal here? And so he actually sedated me, and thank goodness, blessings from above. I really didn't have any pain. So,
Nice.
but if I ever had to have all my teeth pulled, I think I'd call you, Darren.
We get you taken care of.
Yeah. So, but generally, being in that field, what causes you the most stress, or what gives you the most joy or happiness in your field?
I would say the most stress, there's probably two big stressors. First, being a small business owner and just running the practice. So the business side of things is a stressor. It's something that in dental school, they're not very great at training you or teaching you about, is how to run a business. And then secondly is when if you just have a difficult case or a difficult patient. Those are the two big stressors in practice, in my opinion. In terms of reward, honestly, there's a lot of reward, especially I feel like in my specialty, and that's in part why I chose to go into prosthodontics versus just general dentistry, because most of the patients that come see me already know that they have some issues going on with their teeth and mouth, and I am in the position to help get them into a better, healthier state or a nicer smile or something like that. And so I fortunately I don't feel like I'm having to sell dentistry or anything like that. Um, my style of practice is more referral based, meaning that I get a lot of referrals from oral surgeons or periodontists or just existing patients or some general dentists, where if it's just a case that's a little too complex for what they're comfortable with or something like that. And so there's a lot of rewarding treatments that I do for patients in terms of giving them nice smiles where they didn't have a nice smile or the ability to eat what they want to eat again.
Hmm. Yeah, so the stress part's kind of the business side. If you had a good office manager or someone managing the billing and the insurance and utilities and the payroll and all that, have that taken away, that would help a lot. You do a lot of that yourself, I guess.
I do, yeah. So again, my style of practice is maybe a little different than most in that I have a pretty small staff. It's a small practice. It's more of a low volume, high quality style practice, and so I enjoy that. Many general dentist office, they'll have staff of over 10 to 15 people, right? I've got 4 or 5,
Mhm.
so it's less stress in that regard since I'm not having to manage too many employees and less drama that sometimes pops up between employees and things like that.
Mhm.
Um, but because of that, a lot of the roles of HR and things like that do fall on my head. So
Hmm.
whereas you can do a style of practice where maybe you're not a practice owner, but instead you work for what's called a DSO or a dental service organization. These are some groups that own multiple different dental practices and they run the billing, they run the
Mhm.
front desk and all that stuff for you. You just kind of come and you do the dentistry. So there's a lot of ways you can do, be a dentist, and you can choose what you want to do in that regard,
Hmm.
which is nice.
Yeah. So the rewarding side, I guess, is you have a patient that comes in that looks like they live in Missouri or something terrible.
I
I I shouldn't say that, sorry.
have a
Uh,
sister that lives in Missouri. Oh,
I'm
her
sure,
husband's a dentist out that way. So,
oh, is that
no.
right? I'm sure she has great teeth. But they come in, maybe they're in a lot of pain, they can't eat. Maybe some of these people even are have problems with drugs, and I know meth really messes with your mouth,
Yeah.
and being able to see that change where they can resume kind of a normal life and they don't have pain. Is that some of the fulfillment or?
Yeah, definitely. So there's a lot of patients that will come in. Yeah, I'll have some patients that have had a history of drug use. So fixing up their mouths like that, or a history of bulimia, or
Wow.
and then I'm also a little more subspecialized in that I also do some what's called maxillofacial prosthodontics, which is doing some jaw reconstruction work on cancer patients that have had parts of their jaw cut away, and making prostheses for them. So if they had a cancer of the upper jaw and they had to have part of their upper jaw cut away, and now they got this hole that goes from their mouth into their sinus, making a prosthesis to help close that, and so they can eat, function, and speak. Um,
Wow. Huh. That's fascinating. That's very interesting. I hadn't thought of that. Someone that's had cancer and in that area and they have to rebuild, reconstruct. Wow.
Yeah, you quickly realize how hard it is to function when you've got a hole going from your mouth to your sinus. Or even in the rare case, I've had a patient that they lost their eye. They have a hole that goes from their eye all the way to their mouth, and so it's uh,
Wow.
can be very debilitating, but extremely rewarding for them and for me in helping them be able to speak, function, and look normal.
Would that be a permanent appliance or whatever you call it?
It's a removable prosthesis.
Prosthesis.
Yeah.
Huh. Interesting. So, wow. You could walk around during Halloween and really scare
Yes,
people.
yes, you could.
Oh, that's interesting. Huh. So is it a computer that helps build that? That's made, do you make it in a lab or in office or?
But usually you work in conjunction with a dental lab. But it's so in office you're doing the impressions, you're doing try-ins of the like scaffold kind of thing that the prosthesis is built onto and whatnot, and setting the teeth and trying that in and making sure everything looks good and everything. So
Huh. Have you ever worked on someone that survived like a suicide attempt where I shouldn't get so
yeah,
graphic, I guess.
yeah. I do get a few of those patients that come through. Um, you wonder somehow how they manage to survive these, but yeah. Um,
Wow.
I've had a couple patients that we've come through and done some reconstructions on them.
Wow. So you see a lot of patients in a lot of different cases. What does your day look like? How many patients and what kind of stuff are you usually doing?
Sure. It can really vary. So for example, today I only saw maybe 6 or 7 patients because I had some 2 longer appointments where we were doing some multiple crowns on patients. And so it kind of just depends on what we've got going on. So it can vary anywhere from sometimes if it's a big, like a big full mouth case, I'll block out the whole day just for that one patient. And we're prepping crowns on like one whole jaw, one upper arch or something like that. It's at the end of that day, I'm pretty beat. So I only book one patient for that. But then on like days where I have my hygienist there and we're doing hygiene checks and things like that, I can have as many as 20 patients or so, if just depending on what we're doing. Like a denture adjustment doesn't take very long, so
Oh, huh.
it varies.
Wow.
It's
That's
unlike it's unlike my so my brother-in-law does pediatric dentistry, and he'll see 40 patients a day. Um, so it's just very, very, very different than his practice.
Hmm, interesting. So if someone, if you had a nephew or someone that was in high school still and had like a desire to kind of follow the same path, what courses, what in high school or out of high school would you recommend to get him or her into a position like you've got?
Sure. I mean, in the high school stage, the best thing you're going to do is just going to keep your GPA up and get really good grades, so that you could then get into a university of your choice that has at least a good reputation that would allow you then to get into dental school. In high school, I mean, it's going to help, of course, being involved with extracurriculars and whatnot, just making yourself stand out so that you can get into a university of choice. And if you can do certain AP courses just to help you be done with some of the things that you have to do in college anyways, that would be helpful. Once you're in college, um, you're going to have to choose. Most universities don't have like any specific pre-dental major. So you just have to choose a major that usually you'll want to choose one that kind of aligns with a lot of the prerequisite courses needed to apply for dental school. Those are going to be things like your general chemistry, organic chemistry, um, your anatomy, physiology, and some physics. I think they require physics. Um, some microbiology is helpful as well. So a lot of people will either major in some sort of microbiology or something like that, or for example, I did exercise science.
Mhm.
A lot of the courses for that major aligned with the prerequisites that people have to take for dental school or medical school. So
I see.
um, just make sure you get good grades and make sure you that you are trying to do some things that will make you stand out as an applicant for dental schools.
So the competition to get into dental school, I guess you've got to have some pretty good grades and um, 3.7, 3.8, 4.0. I don't know. I guess the higher the better, but
Yeah, I mean, the higher the better. I would say probably 3.7 or above is something, or I mean, you could probably still get in with a 3.6 or something like that, but definitely 3.7 or above is going to be crucial. And then you got to take the DAT, the dental admissions test, it's just kind of like the MCAT for med school. And usually you want to at least kind of on that test like a 21 or 22 or above to be able to get into dental school. If you want to be able to get into the dental school of your choice, it helps to have something more like a 23 or 24, and this is out of 30.
oh,
What the test is out of.
I see. I see. So then you get into dental school, that's 4 years, and then to specialize, it was another 2 years of
Three for
prosthodontist.
my
Three,
specialty. Each
three.
specialty is a little different.
Okay. So, but after that, and you get into practice, and what would you recommend as far as would you work alongside another prosthodontist or your own
Yeah.
practice or
In general, even if you're doing general dentistry or whatnot, the ideal scenario is going to be you come out of dental school. If you find if you're able to align yourself with a dentist that is willing to take you on as an associate, and again, this is where it kind of starts to depend on what your ultimate goals in dentistry are, of what you'd like to do. If you know that you don't like running a business and you just want to go to work, do dentistry, and come home and not worry about all the other stuff, then you can go and work for like a DSO or something like that, a dental service organization, or um, opportunities like that. Um, but I'm going to kind of backtrack a little bit if I can and talk more about paying for dental school, if that's okay, Chris.
yeah, oh yeah.
Just because that the cost of dental school has been increasing so much compared to inflation and everything too. So you got to plan from a very early stage how you think how you're gonna pay for dental school. And most everybody's gonna have to take loans unless you are a trust fund baby or your parents are gonna help you out significantly or something like that. But most dental schools, you're gonna come out of dental school at least a good probably two, depending on where you go, if in-state versus out-of-state, private, not private, things like that. But 250,000 up to 400 or $500,000 in debt. Um,
Wow.
it's a significant amount of money, and it's more expensive than med school even, which is crazy.
Huh.
So that's where you got to kind of start thinking on things. You can think about going military routes to help pay for dental school. So either signing up to do like either Army, Navy, Air Force kind of gig,
Hmm.
and as long as you're willing to do that kind of lifestyle and do the payback time with the military, they'll pay for all your school, which is nice. You can come out without any debt. I have a few friends that have done that, and now they're out of the military and doing their own private practice stuff. Or you got to think about what schools you're applying to. Really look at how much they cost. Think about cost of living while you're there as well, and live cheap. So my plug for all that. But that kind of matters because once you come out of dental school and now you're having to choose what you want to do, you got to think, okay, if you know you want to go into private practice and own your own practice, you got to think you already got a lot of debt from dental school. The bank's not going to just jump out and give you a loan to buy an $800,000 dental practice or something like that, right? They're going to want to see some work experience first and things like that. So, um, if you just want to go out and work and not have to do like own your own practice and whatnot, then working for some sort of dental service organization might be their best, or as an associate for another dentist in their private practice or something like that. That might be the route to go. If you know you want to own your own practice, honestly, coming right out of dental school, you're not going to have the speed uh, doing the procedures and things like that to jump right into it. A lot of students now will go and do a 1 year, what's called GPR, a general practice residency. These are kind of 1 year residencies where you go and you'll work alongside with some clinic. Usually they're associated with either a hospital or school or something like that. And it's kind of like a more school-like environment where you're working under the license of somebody and you're just getting more practice and building up your speed and your skills so that you're more comfortable than coming into the private practice and doing what you need to do type thing.
Hmm. So you've got you had a couple acronyms: the DSO Dental Service Organization,
Organization,
and then the GSW.
GPR, General Practice Residency.
General Practice Residency. Okay. So yeah, it sounds like two great opportunities. I think also to evaluate, yeah, maybe the service is a good way to pay for dental school. I've got
Yeah.
a nephew that's going through medical school and he's in the Air Force right now. And yeah, he has no debt. He has
Yep.
because a great option, but then yeah, like you say, you've got a commitment to fulfill for I don't know what it is, 4 6 years after. Um, so you don't have to pay, you don't have any medical debt. But what option did you just end up taking student loans, or what option did you take?
In my case, I took some personal loans from my dad, um, which was very nice of him to not charge me much, like very, very little interest. So some personal loans from my parents, and then just general loans,
Uh,
so federal loans.
I see.
So I
So
mean, go ahead.
yeah, I was just gonna say, now that you've kind of been through it, besides just the financing part, were there things that you would have done differently, or? think there's only about one path you could take to get to where you got?
Um, in hindsight, I might have considered, so I did consider the military route, but I waited a little too long to apply. Um, to where they wanted to do it so that it would be from the very beginning dental school to the end. They wouldn't do like a partial amount.
Uh,
So so in hindsight, I think I would have done fine in the military. Um,
hmm
so I could have considered doing that. I'm fine with going abroad and things like that. As is my wife, so that's a thing to consider. If you do the military route, are you comfortable with going and living in a foreign country and things like that?
hmm
Um, so I maybe would have considered that, but other than that, there's not a whole lot that I think I would have changed. I was fortunate. I was married at the time, and my wife was able to work remotely, so she was able to continue to work my whole time I was in dental school, which covered our living expenses in San Francisco at least, so that we didn't have to take on more debt for our living expenses.
Wow, that's a real blessing there.
It is. And then we made a commitment to pay off our student loans as quickly as possible. I chose I chose a specialty program that paid me, which as opposed to me having to pay, or as opposed to it being just kind of equaling out to zero. Um, So that way, again, we weren't taking on a whole lot more debt. My debt from dental school was still growing because of the interest rates, but um, so you really got to sit down and think about the numbers of it, because if you think about of an 8% interest rate on 200 or $300,000, that's fairly significant.
Yeah, that
Compounding nonetheless. So
nice. Huh, interesting. Well, if you met, I don't know if there's a certain personality, characteristic, aptitude, if you met somebody on the street and said, "Hey, that person would be a great prosthodontist," what aptitudes or what skills or do you seem like you use every day to help you in your practice?
um, prosthodontists are known to be perfectionists. So sometimes to the extent of being overly anal. But um, you, to be a prosthodontist, you have to have a real extreme attention to detail, because you're not taking the easy way out. You're really making sure that you're getting things done correctly. So it's looking for somebody that would be considered prosthodontics. It's going to be somebody that uh, really cares about doing things based on research and literature. So you you are doing so that you know that your treatment's predictable. Um, Somebody that likes to, of course, work with their hands, and again, is maybe a little bit more engineering minded when it
Mhm.
comes to being able to think outside the box and kind of MacGyver situations. Because as a prosthodontist, you get thrown the interesting cases where the general dentist is like, I just have no idea what to do. And so you have to come up with kind of out of the box thinking of, okay, well, what can we do here to they have this compromise situation here, here, here. Well, what can we do to work around that to make this work for the patient?
Huh. Wow, I didn't know you were a MacGyver type.
Yes.
That's
Yeah.
a lot of duct tape and super glue.
A little more advanced than that, but yes. You got to be able to think out the box, and sometimes you gotta come up with some unique ways to do things.
Yeah. Huh, interesting. Um, it sounds like it's not like I guess you could be like a carpenter. It's like, well, we started this procedure. I'm tired. Why don't you come back next Tuesday and we'll finish? I
Yeah.
guess not a lot of options. Probably we start something. Probably have to, especially if the person's sedated. Probably got to finish. Maybe stress management would be important too if it's not going quite
Yes.
right.
Yes. Stress management and patience. Um, but that's helpful with dentistry in general, just because you're working with a lot of different people, a lot of different personalities. And so you're going to have some patients that are much easier to work with than others. And you need to be able to learn how to work with a lot of different personality types. And
Uh-huh.
um, you also need to be able to read people well and know when certain patients are what we call a red flag, and,
Uh-oh.
and
Really?
when it's maybe better to just say no, or say, maybe I'm not the best fit for you, type thing, to save
In
yourself a lot of headache. Or
Interesting. So you've actually turned patients away then.
not so, I mean, yes, but not in the way of saying like I don't want you as a patient. There's a couple ways you can do it. Where I am not in network with insurance plans, meaning I don't take contracted rates of insurance companies to have them send patients my way or anything like that. I can charge whatever I want. So if it's a patient that I perceive to be a very, very difficult patient, I will inflate my prices to the point of where it'll either drive them away or it'll make it worth my time.
Oh, there you go. So you've got a PIA fee.
Yes. Yes. There have been a couple patients where I have dismissed them, but again, in a nice way, saying that, I think what you're wanting in treatment doesn't align with what I think is the best course of action. So you
Yeah,
would be best suited somewhere else. So
yeah, yeah. Yeah, I've been there, done that. Much different profession with working with people and money and loans, but I've had to kind of say the same things
yeah,
like, we just don't just seem to be the best fit. Maybe you need to go look somewhere else.
yeah.
But yeah, say it nicely. But well, very interesting. So with some parting words as far as like life tips. If you were talking to, again, maybe a nephew in high school and um, some tools maybe that you've used over the years to get through difficult situations, maybe with patients or personal challenges you've had, any tools that you've used that you could share?
Yeah. From having good, healthy outlets, and realizing that, and this takes practice, building the mentality of learning to be able to let go of certain things. And that's I think, a learned skill of being able to manage stressful situations and things like that, and realize that you do your best, and sometimes things may not work out how you wanted or something like that, but just being able to start again,
Mhm.
type thing. I have, if that makes sense of what I'm trying to say there, but
Yeah, I think
um go ahead.
no, I think that's right on. I've noticed through my life, if I run into difficult situations, if I bring emotion to that situation, it makes it worse. If I try to approach a difficult situation and take a step back, try to remove a lot of the emotion, think more logically and rationally,
Yeah.
it helps. Instead of sometimes if you're in a tough position and someone's yelling their guts at you, I did collections for a long time for a crane.
Oh, yeah.
So sometimes, after I repossess someone's car, they're not really happy. And the worst thing I could do when someone calls, and they're really upset, the worst thing I could do is react emotionally to them.
Yes.
It escalates. It escalates things.
It does. And so, yes, that's one thing I've really noticed and worked at with patients that, I get patients that'll come in for second opinions or they've been to another dentist and had issues, right? And I'm the second guy that's trying to fix things. They're frustrated, they're angry. So being able to just be empathetic, right? And help them kind of through that. And sometimes even if they're mad at you or something like that, uh, yeah, like you said, you have to be able to not react. You have to be able to say, I could understand because they're looking for you to escalate too. They want a reason to yell or whatnot. And so if you keep it calm, keep it just level headed, yeah, that helps with that. Um, Other things in general, just kind of in general, I think, if you're it's important. It's hard when you're like high school or just starting to college to figure out what exactly you want to do in life, right? The best thing that I think you can do is just talk to a lot of different people. Um, Take the time to figure out what it is they do, what's really involved with it, because especially if it's an expensive thing that you're considering doing, you don't want to jump into dental school and find out that all of a sudden you hate it and you're already $100,000 or so in debt and you decide to quit. That's a tough situation, which, I saw a few people do that through dental school. So,
Wow.
um, take the time to really figure out what it is you like, what drives you. Realize that now I'm personally of the opinion that you can't just go and choose any major that you think is something that you enjoy. Art majors are fine. I'm just saying you have to be realistic of, okay, what are you going to do with this art major? How are you going to
Right.
make a living? So
Yeah.
be realistic, realize that even though I love what I do, there are hard days. Um, there are times that it's stressful. You have to realize that anything that's going to be good, there's going to be some bad times with it. There's going to be some hard times with it, but that what's going to make it worth it. So
Right. I think that's really wise. Um, if you make a decision to go down that road, before you start the road, maybe go talk to someone, shadow someone in that career for a few
yeah,
days.
definitely
See what,
shadow.
you know, because can you imagine spending $100,000 and then not using it? Oh man.
Yes, yes,
Yeah. See, and that's what I've been telling my sons. I think the days of a generic college degree are over. Unless you're going to become a doctor, a dentist, an attorney, I would avoid school. I wouldn't go to university. I would go and learn a trade.
yeah. Depending on
Um,
what you want to do, yeah, yeah, because it's expensive. College is not cheap, and
yeah,
so unless you uh, unless you have cheap school from a scholarship or something like that, um,
right,
you gotta really consider what it is that you're going to major in, what are you going to do to be able
right.
to make it worth it.
Yeah, it's unfortunate. Doing loans and working in finance for all these years, it's kind of sad. You talk to a lot of people and you pull their credit, and they've got like a ton of student loan debt, and they're working at Best Buy, doing sales.
Yeah.
Um, yeah, that's the kind of stuff that I would love to help young people avoid, and making better choices. But I really appreciate the time that you've spent with us. I know it's very valuable,
No, of course.
and your wisdom, I think, is very uh, valuable. Yeah, I think there's a lot there, and hopefully, I won't have to see you in your office.
Yeah, yeah, yeah. I'm the dentist that you hope you don't have to see.
Yeah, that's right. Yeah. Well, maybe not, I guess maybe it's just a matter of time. When I get in my 70s, 80s, or 90s, it's a matter of time before I see you.
Yeah, well, I will say the majority of my patients are from age 60 to like to 80. Um,
Really? Do
yeah.
you enjoy working with the senior citizens?
Yeah, I do. Yeah, and it's just it is what it is. But
Yeah,
a lot. Sorry, I know we're going back a little here, but a lot has to do with dry mouth, honestly.
really,
Um, yeah. So as you get older, you get on different medications for different, things, hypertension, high blood pressure, or different whatever. And all of these medications have a side effect of dry mouth. And as we get older, our body's ability to cope with those side effects of dry mouth diminish, and dry mouth can really wreak havoc on your teeth really quickly with cavities.
really.
So,
Huh.
um,
Interesting. You don't hear that from the drug companies, do you?
nope, 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 nope.
Huh. Interesting.
Um,
Well, I appreciate all of your time. I know there was another question I wanted to ask. Oh, yeah. I'm sorry, just one more question.
no, you're good.
Um, what is the youngest patient you ever had to put dentures in? Or put,
Ooh, but I've had to put dentures in. Probably of a patient that had all their natural teeth and just lost them due to certain whatever. Um, Probably their mid 20s.
oh, really?
But I've had a few patients that just congenitally have been missing um, a lot of teeth,
Huh.
meaning from birth, they just didn't have them, or something like that, and
Wow.
had to do some things like that.
I would imagine that would be kind of a lifetime of challenge if you start at 20 with dentures. I mean, living for 60 years with dentures, that's not how it's supposed to be.
Not ideal, no, no, just because your jawbone will continue to shrink and shrink and shrink over time. So, the
Oh,
ability to have a well-fitting denture over the course of their life will get worse.
huh. Well, on that positive note, well, no, I go ahead. Sorry.
No, I was gonna say, well, so to end on maybe some my ending parting words of wisdom is, and I tell this to my oldest son, any work that you do, always do it to your best ability, and just make that commitment. If it's a chore around the house with, if you're still with your parents, things like that, or if it's a job or something you had to do, always do the kind of work that you would want somebody to do for you. So,
I think that is amazing. I'm going to share that with my son. Yeah, always strive to do the best in everything you're doing. He's uh my one that's still at home. He's found this new craze. He loves to work out and he gives it everything he has, from his diet to all the exercise that he does. And I think that commitment in one aspect of your life carries over into all of your aspects of your life. You're very disciplined with your physical stature. Hopefully that carries forward to, uh, athletics, or academics. Yeah, I think that's great advice. So, uh, well, Dr. Darren Goring, I appreciate your time,
well,
and
thanks for having me.
yes, thank you very much. And you can look them up if you've got more questions. But
Happy to
thank,
answer. Happy to
uh,
help.
thanks, Darren.